Thank you. I don't know why I chose to follow Claudia, but somehow it seemed like a good idea at the time. Let me first recognize the nurses in the house. Can you stand up? They are the healthcare experts. And it is an honor and an education to work with registered nurses all over this country. We have formed the National Nurses United, 170,000 or so strong, the largest union of registered nurses in the country. And that is a union that will not stop fighting for single payer until we win it everywhere in this country. We literally, I think, live in Dickinsonian times, if you will. It's a time Dickens would recognize for the extreme inequalities that characterize daily life in this country. But he also had that famous phrase, it's the best of times and it's the worst of times. And I think in a way that describes where our movement is. Because on the one hand, we are now part of an extraordinary movement in this country that challenges in a fundamental way the dominance of money and the free market in our lives. That Occupy Wall Street does that in a fundamental way that says we will not be ruled by the market. We will not be consumers. We will be people who are engaged, as that one speaker said earlier, in participatory democracy. That's what Occupy Wall Street is about, and that's what our movement is about. And this is literally the best of times to be a part of a movement that says, no, we will not be ruled by the free market. And instead, we will fight for justice and equality. That for our movement, it is a time of, I think, great unity. That we have recognized that we're going to fight this fight at the state level and the federal level. We're going to fight this fight in every jurisdiction that we can find. And that there doesn't have to be a distinction in terms of those who say, yeah, we got to win it nationally, or those who say we got to win it state by state. We can all work together. Similarly, we have different bills in Congress, but we have unity even among some of those authors of those bills. So we are working together on federal legislation, even if it is on a couple of tracks. We have a great unity here in this room, and I think broadly in our movement, between nurses and doctors, between labor activists and community activists, between patients and nurses and patients and doctors, between advocates of all kinds. And that unity is extraordinarily dynamic and effective. We also, I think, can proudly say, as Claudia said, we were right. That the Affordable Care Act will not work, and that the private insurance system is a business model that has failed and is being propped up, sadly, by our taxpayers' money. And that is what we've got to change. But the recognition, the Affordable Care Act is profoundly unpopular. 42% in the recent poll said that they approve of the Affordable Care Act. The individual mandate is the least popular, and nearly 2/3 of Americans oppose the individual mandate. We are on the right side of this issue, on the popular side. We often forget that. We say, well, the single payer has got this tough road to hoe. We've got to overcome these concerns about a government-run health care, or overcome the concerns that people are going to lose access to those doctors. Those are real issues, but they are not fundamentally where people are in terms of healthcare reform. They actually want us to go farther and to guarantee healthcare. We were right. Now, at the same time, this Affordable Care Act is also in a way the worst of times. Because of course we in California, for example, and I know others around the country, have found that when you try to move single payer, the first response is, oh no, we've got to, from Democrats, from supporters of single payer, is we have got to implement the Affordable Care Act. So right now, as we speak, we're 2 votes short in the California State Senate from moving that bill forward. And the rationale given and the arm twisting that's going on is all about we've got to protect the health exchange in California. We've got to make sure that that is where our focus is. So in a way, that Affordable Care Act is our best opportunity, but it is also a major barrier. And what's important, though, is that when people think of the Affordable Care Act, they think of the individual mandate, and that is their Achilles heel. Well, what's really sad about that, I think, is that the consumer movement, that is the healthcare consumer movement, defined by those Washington liberal groups that work for the Affordable Care Act, that work for the public option, are now dominated and branded by support for the individual mandate. There was a conference, Health Action, in Washington, D.C. I'm sure some folks here may have attended that. That was all about implementing the Affordable Care Act and supporting it. And Families USA, the group that sponsored that, has now branded the consumer health care movement as, yeah, we're behind the forced purchase of private insurance. Yeah, let's just, keep your dinner down on that one. It is unbelievable to me, in a sense. On the other hand, we lived through the fight, so it's not unbelievable. But what that means is that we are the healthcare movement. We are the healthcare reform movement. Those who are invested in the bureaucratic or administrative implementation of a scheme to enrich the private insurers are not doing healthcare reform. They're engaged in some other process. Validate a reform that they shouldn't have supported in the first place, trying to do the best they can with what they got. Some well-intentioned, but they are not doing healthcare reform. That is an administrative implementation. It's not about building the movement for healthcare justice. And I would urge those activists, and I would ask all of us to urge those activists to not do that. To say, okay, you've done it, you tried. Now, we found out, most recently in Ron Suskind's book, Confidence Men, we found out that in fact, as early as March '09, immediately after the Grand Healthcare Summit, Rahm Emanuel decided the public option was DOA. The administration was never, after that point, committed to the public option, and yet millions of dollars were spent, and it failed. But what was behind that? What was behind that effort for the public option, and how did it crumble? Ultimately, I think the fundamental failing there for the public option was that it accepted the market as the paradigm for healthcare. Because it said, we will interject this entity to compete with the private insurance plans. We'll interject a public plan to compete with the private plans, and through that competition, we will then lower prices and improve quality. And if you accept that healthcare is a commodity in the market, then you can accept that it should be affordable. But if you believe healthcare is a human right, it's not a market commodity, and affordability is not the issue. And that is why it is so important and significant that we are a part of this broader movement that is challenging the dominance of the market in our lives. And fundamentally, we will not succeed in the healthcare reform movement unless we successfully challenge that in the healthcare arena. We are actually worse off now than we were even in '09, with 50 million uninsured instead of 47 or 45, right? We have more community clinics that have closed since the Affordable Care Act was adopted. And now we find ourselves in an ongoing defense of Medicare. And what do they want to do with Medicare? They want to set up a health exchange within Medicare. That is the Paul Ryan proposal. Get a voucher and choose a private plan within Medicare. Does that sound familiar? You know, somebody thought of that as an idea, right? And so how do you defend it? If you're an advocate out there saying, yes, I want health exchanges, and yes, I'm going to work to implement them, how do you say that's not right for Medicare? What do you say? Oh yeah, well that's good for the rest of us, but not for seniors. All right, you can make that argument, but how principled is it? What's the logic of it? You've already accepted that healthcare is a commodity to be rated as affordable or unaffordable. You've already decided that the private insurance companies can deliver universal healthcare as long as you force everyone to buy it. So why not Medicare?
It costs too much.
And what happens, and what will happen with the health exchange, or what would happen if they did that to Medicare, is the giant cost shift. Because not only have employer premiums gone up, but the employee share of healthcare costs has gone up even higher. And ultimately, that is the choice we face. As employment-based insurance withers away, you're going to be left with two choices. You're going to have to either individually buy insurance, or we're going to adopt single payer. Those are the only choices that are going to be left to us. And that choice fundamentally comes down to the moral choice between, are we on our own in this society, or are we in it together? And so our movement is ultimately driven by a moral imperative that we are all in this together. And to fundamentally challenge the market that would make us individuals who are on our own to fend for ourselves against a rapacious healthcare system and an economy dominated by the very rich. If we then take this and apply it to the fight to save Medicare, we will be able to take on those key issues. We'll be able to take on, why should government play a role in healthcare? How do we guarantee healthcare as a human right? Then we're on very favorable terms in the debate. And so when we promote single payer, we can promote it from the same basis that we defend Medicare. That we can defend Medicare on the same terms as a universal program for that age group that includes everybody and that works, that gets people health care. But in the present system, Medicare is so overwhelmed by the imperatives of the market and the effort then, when you can't do single payer and you refuse to regulate the private insurance companies, what are you left if you want to change the healthcare system? You're left using Medicare to drive those changes that you otherwise won't regulate for or adopt through a truly universal system. So Medicare becomes the both kind of the scapegoat and also the experiment and the driver for those changes that they want to make in the healthcare market. That's why we experience increasingly dissatisfaction with Medicare, because its very universality and guarantee of benefits is being eroded because it has to exist within the private insurance market and increasingly move changes in that market. So we have to take on that. Now, what are they doing? It's extraordinary, and from a moral perspective, truly outrageous if you think about what they aren't doing, and instead of going after Medicare. Rolling Stone published this article in November about taxation, if any of you saw that, and the Republican commitment to lower taxes for the rich. They determined that the tax breaks and the corporate tax subsidies is worth $1.2 trillion a year. Guess how much the United States collects in taxes total? 1.1 trillion. So there are more tax breaks and corporate tax break subsidies than there is actually tax collected in this country. But those are ruled untouchable. Those are ruled untouchable by the consensus in Washington. No, you can't cut even $10 billion in the subsidy for yachts and private homes. Can't do that. Can't touch that. Right? $680 billion is what the tax cuts that Bush enacted are worth just for the top 2%. $680 billion. Now that's more than, or about what they're cutting from Medicare. But they won't touch those. And the list goes on and on. The oil and gas industry gets about $44 billion in tax subsidies. And I kind of thought, now being in Texas, Exxon Mobil, those guys are doing pretty good, right? I mean, I don't know what the problem is, right? Best ever not paying taxes, right? But they need that $44 billion in subsidy. So here we find ourselves where we started, as part of a broad movement demanding economic justice. And literally the trade-offs in our prize social insurance program are right there before our eyes. That you can either go after the top 1%, the top 2%, the wealthy, or you can destroy health benefits for seniors. And that's supposedly a hard choice? So why is it a hard choice? Well, it's a hard choice in part because the cynicism toward government is so profound. All of us are probably more cynical about government than we were in November of 2008. Just hazarding a guess, right? And that cynicism is exactly what the conservatives and the corporate elite count on. The 1% can only do as well as they're doing if the 99% believes they can't change it. And so we are part, again, why it is such an extraordinary time, because we're part of a movement that says, no, we can change it. And if there is ever a profession that understands the value of persistence and never giving up, it is nursing. Because until you take your last breath, a nurse will never abandon you. And that's what our movement has to be. It has to have the tenacity of nurses and the moral compass of caring and compassionate community that drives their work every day. And it has to take on that cynicism with real engagement, regardless of political party, telling truth to power, enacting those values of caring, and we will prevail because we have to. It is, as someone else said, a matter of life and death. And our movement, within that broader movement for economic justice, brings that extraordinary moral compass that we are about life and death, and the whole movement ultimately is about the survival of working people in this country. And that's what makes it so important, so challenging, and so exciting, and so thrilling to be a part of. So let's have a great weekend. Thank you.